and that also AZT could also cause neuropathy. So I went off of them, and the neuropathy never went away, and it never got better. And as a result of that, I had to go on medications, antidepressant medications, which is what they're using for neuropathy. But I also had to go on pain medications at the same time. And that was a very difficult situation for me. I'm in recovery. This is very hard for me to talk about. And I had for 9 years not taken anything. And all of a sudden I was inundated with medications, as you can well see. And I had to, come to grips with that. And I had to come to grips with taking pain medication at times when I needed it. And realize that I wasn't taking the pain medication to run away from my feelings or to get high, but to enable me to walk.
I have a different perspective as well because I facilitate some support groups for men with HIV, and I really get to see the differences in the issues that men and women focus on. And here there's a lot more concern about disclosure and a different emphasis on supporting each other, and I think an awareness too that we're dealing with issues of sexism, and we deal with issues of domestic violence and drug addiction, some things that are the same for men with HIV and some things that are very different.
I know that if I show my face that I would not have the position that I have now, so therefore I must remain anonymous.
Afraid of losing their insurance, afraid of losing their children.
I had to tell my son because my partner at the time wanted to tell him, and I didn't think he would tell him very nicely.
I was doing okay. I was educating myself. I was getting support for myself, and I was functioning. I was working, and so I just felt like it was no need for my son to even be aware of my situation. I wanted to wait till later, maybe later on, and I expressed that to my husband, and he agreed at the time. But when things didn't go his way, that was one other thing that he held over my head. I'm going to tell your son, I'm going to tell your family. And I disclosed to very few people.
I think safe sex.
Safe sex, we talk about that. We talk about hair a lot.
Yes, we talk about hair a lot.
We've had hair nights.
Because women with HIV lose a lot of hair. We don't know why, and no one can really tell us why. We wanted a non-identified AIDS agency, and the Women's Building is great for that because it's like there's all kinds of groups here. And we wanted a facilitator, and that's when we started looking for resumes and met Michelle.
I still remember very vividly the night you called and said that you wanted me to be the facilitator, and I just was really happy that I was chosen, and it was a feeling, I think, of being wanted for professional skills, but also for who I was as a person. And I think that issue of acceptance is one of the main themes that we deal with in this group.
I was infected in 1982, but I wasn't notified till 86. And I was with him for 6 years, and I walked into his office the next morning. I told him that I was HIV positive, thinking that he would give me some information. He stayed at the far end of the room, and I was sitting there, and he told me he knew nothing about HIV. He wouldn't know how to treat it, and that it would be necessary for me to find another doctor. I left there, and it was then that I realized that people with HIV lose all their identity. You are no longer a person. You become a thing.
The fact that so few heterosexual doctors take care of people with AIDS is an indication that there is prejudice, both against gay men, against IV drug users, even against women with AIDS. Right. The only population there probably isn't any prejudice against is kids with AIDS. But I think the fact that even in San Francisco, a survey was done a couple of years ago at UC in San Francisco that looked at if you wanted to care for AIDS patients, and a lot of doctors in town did not want to, and this is in San Francisco where we have the highest number of AIDS patients in the United States per capita. And the article showed that a lot of doctors try to avoid HIV, and I wish they would sort of rethink this, because they're missing out on a group of people who are wonderful people, and if they open their eyes and their minds, and I think a lot of it is just misconceptions in sexuality, misconceptions that are based on ignorance. And even though you have a population of doctors who you think are very smart and very educated, the prejudices still exist, and I think that clearly that has to change. I think it will, because HIV is going to penetrate every community in America, and every doctor will be caring for HIV.
Back in '85, I had some concerns, and I went to a physician to get a physical. And I had a mass under my armpit area, which a biopsy was done. And at that time, I was told that the biopsy was negative from any type of disease, but it had a lot of inflammation going on with it. And that actually means that my body was trying to fight off some type of infection. I started having a lot of reoccurring bacteria type infections, I guess vaginal type infections, that I would go to my gynecologist and I would get treated, and then a short period of time they would reoccur. Finally, I decided to go to a specialist, a gynecologist that specialized in sexually transmitted diseases, and I was given all these tests, and when my blood panel returned, my hemoglobin, I guess, was very, very high, which means that my body was trying to fight off some infection. And at that time, I was transferred to an internist, and she also did a series of tests, and everything was coming back okay. But I was still concerned about what was going on, what caused this. And the doctors really couldn't answer that for me. So I asked, did they feel like it could be AIDS related? And I was told most likely not, because I didn't fit into the profile of the high-risk group. So they said that you should probably rule that out. Actually, this one doctor, she tried to discourage me from being tested. She says, most likely, you're setting yourself up for a bunch of unnecessary concerns.
I have been infected for close to 11 years, a long-term survivor, and I, too, as Rose said, I am not going to die with this disease. I developed a positive attitude. I had a catastrophic heart surgery and the transfusions. Some of the blood was tainted with AIDS. So when I heard that news, it was quite devastating. I was just recovering from the heart surgery. Devastation just lasted a while till I realized I have to live with it, not only with the heart problem, but with this disease as well. And I would say, so far, so good. I have a great deal of support from family and friends, and above all, this group. I have not been rejected in any way at this point in time, but it was a fright.
I was with the guy that I got it from in '85 and '86, and I got a flu, and my left gland swelled up behind my ear, and I thought that, I was asking people what it was, my relatives in the medical field, and they were saying, oh, it's probably just scar tissue from when you were sick, when I had that flu in '86. My friend, he wanted a ride to the testing center, and I had a car at the time, so I said, yeah, no problem, I'll take you guys, but make me an appointment too. So I didn't think anything of it. I think if I would have thought there was just a tiny little chance that I was negative or that I was positive, I wouldn't have done it.